Welcome to Lymphocure, where we bring you the latest information about lymphedema. My goal is to make this disease mainstream like any other. To help in this effort, you can do one thing. It's easy, it's fast, and it's free. Click subscribe. Thank you. Today, we're going to talk about something that every lymphedema patient needs to know about and understand how to use. That's compression. We're going to talk to someone who has 20 years of experience in compression. She has seen all kinds of patients, all ages, whether it's secondary, primary, or even lymphedema. She's going to tell us how to choose the right compression for you. In order to get the proper compression that's going to contain your swelling, you need to be evaluated, measured, and monitored, and have the garment ordered by a compression specialist. Let's welcome Jennifer Hunt, our compression specialist.
I would like to give a little bit of background about myself. I want to disclose that I am not a doctor, I am not a therapist, nor do I have any concrete medical background. What I am is a compression fitter, and I have earned the title as a compression specialist for the simple fact I've made every mistake in the book, and it's through errors and non-textbook case scenarios that I become very good at product knowledge. I feel like people are not given the facts up front, and that's probably because it's not textbook. Every case scenario is very, very different. And when it comes to preventing lymphedema, you're being proactive instead of reactive. I'm a sole believer of that. But at some point, unfortunately, lymphedema will rear its ugly head and it becomes chronic. Lymphedema doesn't come and go. So people that experience swelling that comes and goes, and they have had trauma to the lymphatic system, I wouldn't necessarily say they have lymphedema, but there's a red flag somewhere. Something isn't working correctly, and the fact that it's not failing every day is a bonus, but if it's not paid attention to, chances are that's the direction it's going to go in. And in my 19 plus years of experience, I have found that most negative experiences with patients that have lymphedema is because they were fit with the incorrect garment. And what's best for a patient today may not be the best 6 months from now or in the summer. So all that being said, I'm here to discuss things like why compression is beneficial, what type of compression is best for you, how often you should wear it, how compliant you should be. Any type of edema, whether it's lymphedema, lipedema, vascular edema, post-surgical edema, compression is always going to be the better choice. And that is the way we control edema. However, it's the type of compression that makes it effective or not effective. And this is probably the biggest obstacle that we have in the lymphedema world and as a compression fitter. So doctors are very quick to see a swollen leg, swollen feet. Oh, go get yourself some compression stockings. And we refer to those type of stockings as a circular knit stocking. I don't like to use the word custom or non-custom because you can custom make anything. You can custom make a circular knit garment. You can custom make a work knit, flat knit. Anything can be custom made. But there are lymphedema garments that are very specific to the custom world. And we'll get into that in a few minutes. But why compression is so important is when there is trauma to the lymphatic system and your body is not filtering fluid as efficiently as it should, it backs up. And if you think about a creek, and a creek where the creek hits land and there's no current, that water gets nasty, gets thick, it gets gross, and depending on how stagnant or the lack of current that's in that area will depend on how problematic that fluid becomes. However, there's going to be a storm, or there's going to be a heavy rain, or there's going to be something that will cause a current. And that current is going to force that nasty, stagnant, heavy water towards faster running water. That faster running water is going to intercept it, filter it, redistribute it, and it's beautiful, clean water again. But when the storm goes away, that fluid is just going to backfill right into the creek. And depending on how frequently that area has a storm, really depends on how dirty or how problematic that fluid becomes. Well, that's one of the better analogies that I can describe on why compression is so important with lymphedema, because your lymphatic system is your filtration system. And when that system is compromised, nothing is filtering the fluid, or it's not filtering as efficiently as it should. So gradient compression is what moves fluid from point A to point B. Having something tight might feel good, and it also might give resistance, but it doesn't move the fluid. What moves fluid is a path of least resistance. And how you push fluid from the distal end of the body to the proximal end of the body, or arms and legs, you are going against gravity. So you must have a higher pressure at the furthest distance from the heart, and that pressure will decrease. And as that pressure decreases, your fluid will move. Now, there's 1,000 other components that will make that successful, as far as the severity of the blockage into the lymphatic system, the patient's compliancy, how old a garment is, the integrity of it. Is it the right kind of garment? Is it the right stretch? Is it containing? There's all of these factors that will compromise that gradient pressure. So this is where I come in. We know that compression is essential for lymphedema. So when that fluid sits, or it doesn't move, or it's not decongested, it's going to grow protein. The definition of lymphedema is protein-rich fluid. What happens when fluid doesn't move? It becomes fibrotic, it becomes heavy, it becomes thick. And this is what increases patients' risk of cellulitis. And cellulitis can happen to anyone, but it's very, very common in lymphedema because it's the lymphatic system that does your filtration. When fluid is dirty, it doesn't move, it gets hard, it gets fibrotic. This is what puts people at a very high risk for cellulitis. And cellulitis is an infection that occurs under the skin. So some people don't even know they have it until it's too late, and it will rear its ugly head. And all of the treatment of lymphedema isn't about being cosmetic or having one leg the same size as the other, but it's about minimizing the risk of infection and progression of disease, because that is exactly how that disease progresses. It's lack of compression, lack of education, lack of decongestion is what makes lymphedema go into severity. If you are compliant and you are knowledgeable of how to wear compression, how to use compression, when to introduce compression, you will greatly minimize your risk of disease, of progression of disease, as well as infection. So back to the circular knit, custom, flat knit, all of that wording. Circular knit garments, which are very, very common, they're affordable, and doctors are very quick to prescribe them, are not ideal for patients who have chronic lymphedema or lipedema or any type of condition that creates heavy adipose tissue. So a circular knit garment, whether it's custom made or off the shelf, has a very high resting pressure and a very low working pressure. And what that means is the elasticity of a thin, seamless stocking. And to give you an example, this is an arm sleeve. This is a better ready-to-wear arm sleeve, or a circular knit arm sleeve, but it's seamless and it's stretchy. And this is what a compression stocking would look like. This type of garment is going to have its maximum pressure where the circumference is the smallest, which typically is above the ankle bone. That being said, if you have lymphedema in the lower extremity, most people present in the foot and the ankle. So if I take a highest pressure and I put it above the ankle, not only am I not addressing the edema in the foot and the ankle, but I'm creating a tourniquet. I have maximum pressure above the ankle, which is going to trap that fluid in the foot and the ankle. which is so common with lymphedema patients who wear circular knit stockings. The other disadvantage to a circular knit for a lower extremity is the areas that do engage the larger muscle group, your calf, below the knee, the widest part of your thigh. A circular knit garment has a very low working pressure. So that's the areas that will engage because the muscle group is larger. So something that is thin, stretchy, seamless will give. There's elasticity. It's going to expand. Therefore, it's not containing that fluid and it creates backfill, creates a tourniquet. It's going to squeeze at the ankle. It's going to squeeze behind the knee. It's going to squeeze at the elbow. And that will trap fluid. It prevents that gradient natural progression of fluid that we so desperately need. So for the most part, I will say, depending on the severity of the lymphedema, a patient's presentation, it is not the best choice. Circular knit is not a lymphedema garment. They certainly recommend it for prevention for a patient who may have had significant lymph node dissections. Maybe they had a surgery that lymphedema could be a side effect for. Upper extremity breast cancer patients, absolutely, wearing a prophylactic compression circular knit sleeve after surgery for travel, exercise, even just to help regenerate lymph flow, smart. Great thing to do. Never hurt you. Assuming it fits correctly and the compression level is appropriate, and that's for your doctor or therapist to decide, I am all about it. And we talk about air travel a lot because everybody swells on an airplane. So wearing a compression garment when you have had a compromised system, whether you have lymphedema or not, is just smart. It will never hurt you if you are wearing the right type of compression. So that's my opinion on circular knit. There are exceptions to every rule. There are patients that have improved significantly due to treatment, due to surgeries, due to compliancy, due to education. And over time, I have seen patients transition from a more aggressive garment, like a custom flat knit, into a circular knit. And at the end of the day, if you can stay contained, wearing minimum compression, that's where I want everyone to be. So let's move on to the real lymphedema garments. Now, I use the word flat knit, and the reason being is the same companies that make circular knit, most of them will make a flat knit garment. And this is a double knitted stitch that is very, very specific to lymphatic flow. And these machines will knit these gradient pressure garments and they knit them flat. That's why they call them flat knit. So all flat knit has a seam because that's how they create the shape. Whether you see the seam or not, it is a seamed garment. And the purpose of this garment is not to have that kind of elasticity that you get with a circular knit. So back to that high resting pressure and low working pressure, that's not the case with flat knit. It's the opposite. It has a very low resting pressure and a very high working pressure. And this is much more important to the lymphedema patient or the lipedema patient or any type of chronic protein-rich fluid, whether it's secondary to a vascular disease, whatever the reason. These type of garments, and there's a whole world within the flat knit. So there's different types of fabrics. There's many levels of compression. There's transition of compression. And this is really important because lymphedema patients have much harder adipose tissue. Now we're working with fibrosis. We're working with fluid that needs to be broken up. It needs to be moved. So most lymphedema patients cannot elevate their leg or their arm for 10, 15 minutes and fluid goes away. That's typically not the norm for a lymphedema patient. So now we need much more intense resistance to get fluid to move. And I want to really emphasize that this doesn't necessarily mean higher levels of compression. So many patients just want so much strength because they feel like the tighter, the better. And sometimes that's very true. If I'm dealing with a very large, asymmetrical, fibrotic shape, sky's the limit. I'm going to use a Alvarex garment that is latex based and it's non-forgiving. And that type of garment is very appropriate for patients that have large lobes or they don't have a symmetrical shape and they're not contained wearing anything except maybe layers and layers of short stretch bandages that they have been using through a decongestive treatment. However, that's the extreme. And then you have the very mild. And these are patients that have had significant trauma. They have a chronic condition, but maybe they are still symmetrical. Maybe their fluid can be moved pretty easily using pneumatic pumps or manual lymph drainage. So these are patients that probably still do need a flat knit, but we would use a much more flexible fabric, maybe with lower levels of compression. We would determine how easily fluid backflows. So there's so many components that I have to consider when I'm recommending a garment. So knowing all of those different factors and trying to make a decision, one of the advantages of custom fitted flat knit garments is the sky's the limit. The technology that has evolved in the last 10 plus years is amazing. So back in the day, if you had severe foot edema and your toes were involved, you would have to put on a toe cap, and then you would layer that with another, like a knee-high length garment or a thigh-high length garment. And then sometimes you would have to layer even that with another level of compression for above the knee. It was very complicated. But the technology has really advanced where you can have different levels of compression within limits in a limb. So traditionally, the foot and the lower leg is almost always a problem compared to the upper leg. So that's kind of easy to take gradient pressure and get it to go up. But you also have the situation where maybe the foot's not involved, but the calf or the thigh is. And now it gets complicated because the highest pressure needs to be in the foot to get fluid to move. And now that's going to be a problem because that higher pressure is going to be very uncomfortable for the patient because their body doesn't need that type of intensity in that area. And this is where I feel like amateur fitters make mistakes. So instead of adjusting compression levels or using different fabrics, they put band-aids in these garments. They use silk patches, or they increase circumference measurements and just to try to make something more comfortable. And I'm not saying I've never done that, but that's my last possible resort because the garment is designed to move fluid from part A to point to B. And if you don't follow that gradiency, you are going to miss the boat. You are going to compromise that garment right from the get-go. So this is where a fitter is going to know, hey, what manufacturer offers bells and whistles in a garment that would complement what that patient needs. And sometimes you have to layer, sometimes you don't. Sometimes you have to attach a toe cap and not have it overlap. Sometimes we use a different product on one part of the leg and layer it with another product. So this is where containment is so important, and it's a trial and error. And I know with the expensive garments that's ridiculous, but if you are hooked up with a good fitter, these manufacturers will bend over backwards to find the right fit for you. They want you to use their product. So if you have someone who is knowledgeable and is able to discuss what manufacturer is best for your presentation, you will be successful. A lot of therapists will stay away from custom flat knit garments because they're difficult to measure for. And some therapists, depending on what state or what part of the world you're in, they don't have educated fitters. So the therapist has got two things. First of all, she's got to maintain what she's been able to achieve with the patient. Then it has to be something that she feels comfortable doing. As most of you know, these things are very expensive. And if the patient's paying out of pocket and the therapist doesn't feel super comfortable, sometimes they skip a very important step and they just put a patient in something that is easy and that bulletproof, that you take a couple measurements, you fit into a size, they know it's going to work, but it may not be the best choice for you. I actually just recently made a transition in my employment to work with a company that has national billing. And the reason why I did that is it gives us the ability to reach out to patients in other states who may not have a local durable medical equipment company or a local provider that could submit for their insurance. And maybe what they think is unreachable is reachable. There's just so many components here. I don't want to get off on tangents, but I just want to explain that there isn't a right or wrong answer. The right answer is what garment is going to keep the patient compliant, because consistency is what lymphedema will respond to. It's not much different than losing weight and gaining weight. You go on a crash diet, you lose all this weight. As soon as you go back to your eating habits, not only do you gain the weight back, but you gain a little bit more. Fluid responds in a similar manner. If you compress some days and some days you don't, and you are a chronic lymphedema patient, you are doing yourself so much harm that you may not even realize, because by allowing your measurements to fluctuate will always compromise your garments. And when you compromise your garments, you're never going to get a great fit. Therefore, you can't get the benefits of consistent compression. And wearing compression all day, every day is very important, but there are other components to managing lymphedema. And one of these components that I am a huge advocate about are nighttime garments. And over the last 10 plus years, nighttime garments have really evolved into some pretty amazing tools in the shed, for lack of a better description, for a chronic lymphedema patient. So we go back to that analogy that I used with the creek, and how the end of a creek where there's no current, that fluid gets fibrotic. The reason why it is not recommended, and again, there's exceptions to all rules, but for the most part, it is not ideal to wear gradient tight compression stockings to bed. And the reason for that is when you go to sleep, your heart rate goes down and your circulatory system slows down. So when you aggressively force fluid towards your heart and your heart rate is down because you're sleeping, your body isn't able to process that fluid or intercept it in the way that it can when you're awake. So a lot of times that fluid will reflux. It goes back down the limb and it can be very damaging to your veins. So that is the number one reason why most doctors or physicians will say, don't ever sleep in a compression stocking. Now, again, after surgeries, there's a lot of vascular procedures that for several days after procedure, the doctor has shut down a certain vein and they might say to sleep in it. I will never, ever override a doctor's recommendation. I do not have the credentials to do that, but I do want to let you know that for the most part, it is never recommended to wear gradient compression when you are sleeping. So what they want you to do at night, and anyone that has gone through decongestive therapy where short stretch bandages are involved and there's layers and layers of bandaging, you are much more familiar with that feeling or that success of breaking up protein and seeing reduction. So there are many clinics out there that operate differently. And for patients that are very severe and there's a significant difference between the limb, there are therapists out there that will see you 3 to 5 days a week and you stay in bandages nonstop until you plateau. And when a patient plateaus, I'm usually called into that equation. I'm asked to evaluate that reduction, and I then measure and make recommendations on a maintenance to that process. In a perfect world, that's how it should be, but we don't live in a perfect world, and I feel like that should be the norm and it's more of the exception. So a lot of clinics will just accommodate the patient and they come when they can and they wrap when they can, and they still see progress, but sometimes it's 2 steps forward, 1 step back, 2 steps forward, 1 step back. And because of that, somebody got really smart and they'll make a compression garment that can be used as a supplement to short stretch bandages. And these typically are garments that adjust, they Velcro. So why these garments are very versatile in the lymphedema world is because during that decongestive stage, using adjustable garments will not only keep that 2 steps forward and sliding backwards, then going forward and sliding backwards, because you can take off that bandaging process, you put your adjustable garment on, it will help contain. And then the next time you go to treatment, you reduce a little bit more and you can contain. And the garment is designed to keep shrinking. So again, there's 100 different variations of those type of garments, but they're a wonderful resource for patients who cannot give the time or are not involved in a clinic that is aggressive, where they are going to work with you every day until you hit that personal best. Sometimes it comes down to insurance copays, and your insurance won't give you that many visits. So a therapist will take it, they'll spread it over time, and a lot of times they will recommend purchasing or using these adjustable garments as a supplement to their treatment to allow that patient to get the maximum reduction out of their benefit. So in the adjustable world, again, 100 variations of strength. Which one is best for you? Is it symmetrical? Is it fibrosis? That's where a good fitter will help you choose the right garment to give you maximum results. At the end of the day, it should always be the patient's choice and what it's going to take to make the patient compliant. You can pay for the best garments in the world. If you don't wear them, they are not going to help. So the patient's input is critical to success. And I would hope that your therapist or your fitter or whoever it is that you're working with is listening, and be your biggest voice. Be honest. Say, hey, I got little kids, can't do this all day. Or, I have a professional job. I'm an attorney, I have to present in a courtroom. These things are important because all of this is about quality of life, and we want you to have the best quality of life. So I'm not going to say there's one manufacturer better than the other, or there's one garment that's better than the other, because there isn't. It's about what's best for the patient. And this is where having education and knowing what is available is important. And stay off of Amazon. Amazon is a wonderful resource for almost everything except compression. Amazon is a search engine. So when you Google something and all these compression garments come up on these websites, you really have to understand what those garments are. There is a shelf life to elasticity. Typically, you wouldn't be able to get anything custom made online anyway, but an ill-fitting garment can cause more harm than good. And even though those manufacturers are the best of the best, it doesn't mean that's the right thing for you. So please don't take it upon yourself to try to research these products without guidance, whether it's from your doctor, whether it's from a therapist, whether it's from someone in your support group, because what's right for them may not be right for you.
Did you subscribe?
About the nighttime garment, over the last couple of years, these garments have evolved into some streamlined products where they're not all custom made. When I first started in this industry, if it was a nighttime garment, it was custom made. That is not the case anymore. I mean, there is nothing better than a custom fitted garment. It's probably true of everything in the whole world. However, these manufacturers have perfected things to such a level that if you have symmetry, and not all lymphedema patients have symmetry, you really can create a channel that will work. And because it is not a very tight fitted garment, because we don't want that when we're sleeping, they have done a really, really good job with creating some of these chip foam garments for patients that are a lot less expensive. So the philosophy of these type of garments is not to compress fluid, but to decongest fluid. So we go back to when you go to bed at night and the heart rate goes down and that fluid is sitting, and all those hours that you're sleeping, that fluid, because it's not moving, can become fibrotic. It can become problematic, just like the creek. So you have to create your own current. You have to create your own storm. So what they do is they take this very puffy type of foam, it's almost like chip foam, and they sew it in a channel. This particular garment is a ready-to-wear product by Medi. It's called the Profile, and this is a vertical channel. Now, although this would be a great alternative cost-wise for a custom garment, if it wasn't primary lymphedema, which means it wasn't something that you were born with or you had all your life, it's not my personal favorite for decongestion. What I prefer, the channeling that I absolutely prefer for secondary lymphedema is the chevron channel. So this is a sample of a tribute, and this channel is going diagonal. So it would be different for left and for right. You want to channel the garment in that manner. And this, for years, was only available in custom. And then they came up with a low profile version, which is basically the same thing, but they took that channel and they just sewed it in a thinner version. So what that does is it thins the garment almost by half. I don't know if you guys can see that. So again, this isn't for everyone, and nor is this. I would probably choose the low profile for that much thinner patient, a patient who is very, very controlled, who is compliant with daytime garments, but definitely needs the decongestion process at night. This would be an option. For that more fibrotic patient, the patient who is out of control, who has to wear higher levels of compression, who needs to be in a custom fitted flat knit garment, this would probably be the better choice, or the profile. And within these garments, oh my gosh, the sky's the limit. You can put zippers in them. You can put adjustable panels. You can put jackets over top of them that add additional compression. And this is a Medivin ready to wear profile. They are left-right specific. They have some little pull-up loops. That's what I'm doing. I'm gonna pull my arm. It's gonna come right up into your armpit. It's a little too long for me. And it looks like an oven mitt. Very flexible, super comfortable, cool to touch, washer and dryer friendly. But when you are sleeping, this channeling is going to decongest that pitting edema that is stubborn, the edema that just becomes heavy and hard, and it's what progresses the disease. This garment will channel. Now, if you had someone that loves you enough to stay awake all night and massage your limb, that also would work. Just don't know anybody that has one of those. So again, that's why these companies got very smart and they created these type of devices. But let's just say it's not enough. You know, even though you're wearing custom flat knit garments all day, you're wearing a nighttime garment, you have a pneumatic pump, it's just more problematic. There are ways to add integrity, and this is called a outer jacket. This is a stretchy sleeve that actually goes over the garment, and this sleeve will add about 10, 15 millimeters of pressure, and it will engage this density of the foam in a more aggressive way. Super comfortable, it's thin, it's silky, but just that little extra oomph sometimes gives that boost to get that fluid to move. Very effective. There's even another step that another company offers, and it's called a variable compression jacket. And this is a very expensive option, but very effective. And this jacket is something that you can put over an arm sleeve, a channeled arm sleeve, and it comes for upper extremity and lower extremity. It has a zipper, almost made out of a non-forgiving neoprene. But what it has are adjustable panels. So as this goes over the chip foam, you can control how much integrity that you want over it. So this layered with the chip foam garment, in my opinion, is almost as aggressive, if not better, than actual wrapping with 1/4-inch foam. And I'll tell you why. It doesn't fatigue. So when you go through a decongestive wrapping, whether you do it yourself or whether a therapist does it, that wrapping will fatigue and the limb will shrink. So when the limb shrinks, the bandaging doesn't self-adjust. So what happens is it loosens, it slides down a little bit, and it's not uncommon for patients to get pocketing or it'll slide down a little bit and it causes more fluid in one area than the other. Plus there's human error involved in self-bandaging. This is a way to take that philosophy and make it so perfect that you can self-adjust it. So when the limb starts to go down and decongest, you snug it up. If you had a bad day or you were non-compliant with something and things got a little out of control, by adding something like this, you get right back into control. So again, it gives the patient choices. It It allows you to adjust garments to your life. We don't want you to switch your life to be to be able to maintain your lymphedema just by wearing garments from 7 in the morning till 5 in the night, and then 7 at night to 8 to do this, and then 8 to 10. That's not what it's about. It's about having the resources to allow you to live your life. So whether you work at night, you sleep during the day, vice versa, maybe you travel all the time for your job, these tools are there for you to help maintain yourself in a positive way. And this is a newer type of garment. This is a below knee. Now, this is not for the severe patient, okay? This is more for the chronic but mild patient, the patient who has had a surgery or who is waiting for rejuvenation of lymph flow. This is for a patient that may have had a lot of trauma but hasn't had horrible symptoms. But this is a microfine garment. And what this does is it massages fluid enough when you are sleeping to prevent it from getting hard, but it's not necessarily so aggressive that it needs to completely decongest. And it is a wonderful product for that controlled but chronic patient. It's for upper extremity and lower extremity. It is only available in custom, but it's not terribly expensive. Or some of the custom larger channeled garments, they can really get into like the thousands. So that being said, if anyone has any questions about this, or they feel that something milder, something less aggressive would be better for them, I would be happy to discuss that with you. As far as how often to wear garments, can't wear them enough. However, you treat your symptoms, not your diagnosis. If you are able to wear a compression garment for 8 to 10 hours a day comfortably and not swell, come home, take it off, take a break, eat dinner, take a shower. If you have a pneumatic pump, any fluid that you would have accumulated at the end of the day, a lot of times the pneumatic pump will pull whatever residual fluid accumulated out, and then you would want to transition quickly from that to a nighttime garment. And then when you wake up, you go right into the daytime garment.
The question I have is there an advantage to taking a break from compressions, maybe 20 minutes, an hour or something?
Is there a benefit? I wouldn't say that it's a benefit. I'm going to say that it's not necessarily a disadvantage. So this is about the refill of fluid, and everyone is different. I have many, many patients that cannot go 5 minutes without that horrific refill. I have patients that don't refill for a day. All of those symptoms will help me choose a garment. So if that is the case, I'm usually aware of that when I'm making a recommendation. So I'm not the doctor and I'm not the therapist. What I will emphasize is you know your body better than anyone else. If you can go several hours without wearing compression and nothing bad happens, and you follow a routine, and you wake up that next morning and you are at your personal best, no harm done. What I will say is, if you are a controlled patient and you're going out to dinner, or maybe you're going to a wedding, you want to wear a pretty dress and you don't want to wear an arm sleeve, that's what I want you to look at, is like, what happens if you don't go 4 hours with the garment? If very little happens, or whatever does present can be undone by, self-bandaging or wearing a nighttime garment or using a pneumatic pump, and you can return back to your personal best, do it. These garments aren't meant to be a death sentence. They're meant to be a tool to allow to live life the best that you need to live. I would have to say, this is probably true of all parts of your life, be compliant when you can, not when you want. And then when you can't, it's not that big of a deal. Just wants and needs are two different things. And just make sure that you're paying attention to that. Other than you, Dominique, you're not the norm. I'm going to say most people are probably less compliant. And that's why there's more than one tool. So, there's a reason why there's all of these different things, because the idea is that we meet the patient's need, not necessarily dictate what the patient should and shouldn't do. If you have chronic cellulitis, you need to stay in compression. You know, if you get cellulitis 3 times a year, you need to stay in compression. If you've never had cellulitis and your symptoms don't seem to worsen day to day, you still need the compression, because what you don't want is fibrosis under the skin. But yeah, I mean, if it were me, I would take a few hours here and there. Sure.
My name is BJ. I'm just wondering, with the one garment that you had, they don't do a lot of them for the lipedema, and
Lymphedema.
with those, they get so huge, you cannot be really uncompressed, and then they tell you so late, because mine was really small, and then they just started growing real crazy because they're paying attention to my leg, not my thigh.
I see.
So,
You're right. Okay.
uh-huh.
So lipedema and lymphedema are treated the same way, but it is a very different presentation.
Mm-hmm.
So lipedema is a fat disorder. It's the way your body processes fat, and it gets stuck in these clumps. And,
Yes.
and usually very uncomfortable, very heavy. And we refer to the adipose tissue because it's heavy and it's uncomfortable.
Right.
Lymphedema is definitely more of a fibrosis that you
Uh-huh.
don't see in lipedema, but it can go into lymphedema. So people that get lipedema, and that's a hereditary, something you're born with, you can't control it. It's got nothing to do with how heavy you are or lack of exercise. So unfortunately, it gets misdiagnosed all the time.
Right.
You want to diet, work out more. It's ridiculous, because it absolutely, not only does it not help, sometimes it makes it worse. So supporting that adipose tissue is really, really important. And for my lipedema patients that actually make it into decongestive therapy, and I feel like a lot of doctors don't go there because they feel like it's not going to help, because you may not see circumference differences with lipedema as you will with lymphedema. So therefore it gets overlooked.
Right.
So you will reduce in short stretch bandaging and adjustable garments. Now that channeled garment that I showed you, I have used that for lipedema patients that I customize. And what I usually do is put an adjustable panel in it. So it allows the patient to make it tighter or adjust it, because lipedema will fluctuate much more frequently than lymphedema.
I have just daytime garments, but I do sleep in the garments. Is there a disadvantage in sleeping with those on?
It's very dangerous. You should not be sleeping in your day garments. And one of the things that I did not mention that I would like to take a minute to talk about, because this is so important, it's compression 101. It is critical to wash your daytime compression. I don't care if it's off the shelf, I don't get custom flatten it doesn't matter. If you are wearing gradient pressure, you must wash it every single day. And that is so important, because what makes compression work is not that you have something tight from point A to point B. Might give you resistance, might feel good, but that is not what moves fluid. It's gradient pressure. And these garments are sewn, they are designed, they are structured to have a higher pressure at the distal end of the body. And that pressure very strategically decreases as it moves up a limb. That is very specific to your vascular and your arterial system. So when you wear something throughout the day, it's fabric, it's going to fatigue just like anything else. It's stretchy, it's supposed to be tight. As soon as you put it on, that garment is fatiguing. So you will not get the same containment from hours 6 through 10 as maybe you got from hours 1 through 5. It is the washing process that restores that garment strength, and that's what makes it effective. So one of the things that wears out with these custom-made garments is their memory. So as a garment ages, it doesn't fall apart. They're extremely well made. It's their ability to apply gradient pressure. It will just eventually wear out. These manufacturers got together 100 years ago and they decided 6 months was this magic number. I've been doing this a really, really long time. I'm going to say, depending on your skin type, how often you wash it, whether you're following the rules, 6 months is an average. I have some patients that don't get 4 months out of their garments, not because they're doing anything wrong, but their edema is so aggressive that it just wears the garment down. And I have other patients that maybe get 9 months to a year out of it. But just because a garment fits does not mean that it is moving fluid. So the rules: never wash it with fabric softener, never wash it with Floride. The other thing is, do not put lotion on your limb before you wear it. And this is strictly for day wear. If you want to moisturize at night wearing a nighttime garment, it might make it a little warmer, but it will not hurt it. But what happens is the garment's going to absorb that mineral oil or that lotion, and it compromises the garment right from the get-go. If you can machine wash a garment, it's typically preferred. I'm not a big fan of using the dryer, but every manufacturer will give you different recommendations. And if you're on the fence, follow their recommendation.
Did you subscribe?